I am making this video to let you know what it's like. 3 days out after having back surgery, I had a hemilaminectomy and microdiscectomy at L4-5 for a herniated disc. Just a little background. I dealt with back pain on and off for years. Normally, after 2 weeks, it would go away. This most recent time, I've been dealing with it. It's currently May 22nd, 2023. I've been dealing with it since December. And in February, I, I just wasn't as smart as I should have been with it. And didn't quite listen to my body. Had ended up having numbness and tingling and weakness into my right leg, and that's where I knew I was in real trouble. Stopped doing a lot of the weightlifting and things that were causing me issues, and tried to do all the conservative measures. Physical therapy, chiropractic, red light therapy, make sure my nutrition's on point. You name it, I tried it. It wasn't getting better though, so ended up having that surgery. That was May 19th, so 3 days ago. So I'm 3 days out, and it has been a night and day difference. But I wanted to make this video so that way anyone watching could know kind of what to expect and maybe some things to prepare for before they have the surgery. So that way they're set up for success at home and don't have as many obstacles. I am a physical therapist. I have my doctorate in physical therapy. So yeah, I kind of knew some of these things, but having to live it definitely is a little different and gives me a new appreciation. So one of the things definitely for when you get home to make sure that you have, I would say, is a raised toilet seat. Luckily, I was able to get my hands on one. I had someone loan me one. You can get them loaned to you, or find them, ask your doctor or surgeon where to get one. This is definitely a must. Just especially if you have a lower toilet seat, it is going to be very difficult getting on and off the toilet without a raised toilet seat. So make sure you have that and you properly set it up. It will make your life a lot better. I also just took a shower today for the first time. When you're taking a shower, make sure you have someone with you. That seemed to go pretty well overall. I had a shower bench, a tub bench at my disposal if I needed it. I ended up not using it, but if you're not steady on your feet, it might be a good idea. You just want to be very careful about how high it is, and make sure it's the appropriate height, because if it is too low, again, that's going to be very difficult to get up and down. It's going to be pretty painful. So let's see. Also, with my experience after this, day one going into surgery, I was just ready to have it done for one. Came out of it. Make sure you have someone to drive you home. They do give you a bunch of pain meds and stuff like that, so do not plan on driving for quite a while, and you're going to be not able to bend, lift, or twist, and you're not going to be able to lift or carry more than 5 to 10 pounds for 6 to 8 weeks. So you're going to want some help, especially getting around. You might need help getting dressed and that kind of thing. Make sure you time out your pain medication appropriately. Don't wait, okay? So as far as if they say to take it every 6 hours, take it every 6 hours. I will say, I'm pretty fortunate. I have not, so they gave me Norco and muscle relaxer. Took that right away after the surgery, and the next day, yesterday, so the surgery was Friday, then on Sunday, I took it in the morning more as a precaution. I really wasn't in too much pain, and then didn't take it the rest of the day. I took some ibuprofen later in the day, and I took the the Norco again at night, just as a precaution. Today's Monday, 3 days later. I haven't taken the Norco at all. I don't think I really need to, so I'm going to avoid it, just because, for one, I don't really care how it makes me feel. Norco can be addicting, so you want to be careful with that. However, if you need to take it, it is there for you to take it, and they do give you a prescription for up to 5 days. So don't force it. Again, if you're in pain, take it. That's what it's there for. But yeah, I don't think that I need to, so I'm probably not going to be taking it anymore after this. I'll just be taking ibuprofen as needed. Make sure that you go over with the staff in the hospital how to do a log roll technique. I made a video on that as well that I can put in the description if you do not know what a log roll technique is, but that's getting in and out of bed. Getting in and out of bed is going to be difficult for the first couple days. It's your back's going to be stiff. That's where they cut into you and they did an operation and everything like that. So you're going to be a little slow moving. That's normal. So make sure you're using the log roll technique to avoid putting any strain on the spine, any bending, lifting, or twisting. You're going to really want to avoid that. And with the log roll, that allows you to keep it straight. It is going to be a little difficult. Again, you may need help getting in and out of bed. So have someone with you the first couple times. I would say that you do get in and out of bed. And that's just smart anyway, to have someone with you. Just if you're on pain medication and stuff like that, you really shouldn't be left on your own. Let's see, what else have we had difficulty with? I haven't had to drive yet or anything like that. I would say the car ride home, make sure you have a car that's appropriate. I would avoid like a low car, something with really low seats. Make sure you can get in and out of that okay, and that you've got an ideal car to get into and out of for your back. Because again, you're going to be slow moving, it's going to be stiff. So you want to make sure you're comfortable on that ride home. If you can, I have a bed that has an adjustable frame. It's been a lifesaver. So if you're looking at getting a new bed and you're going to get one anyway, get one with an adjustable frame that you can raise and lower with just the push of a button. It makes it super easy because you can't sit for long periods of time. I'm pretty much limited to laying down or in a reclined position or standing. Sitting, for me, the surgeon recommended limiting it to 30 minutes 3 times a day to avoid that pressure on the spine and continue to protect the spine. So if you have an adjustable frame, it just makes life a lot easier with hanging out in bed, which you're going to do a decent amount of. Some things that I recommend too are making sure that your nutrition is in check. You need to make sure you're getting a lot of protein, getting your fruits and vegetables in, eating fiber to help you with goal number 2, and avoiding constipation. So you'll want to take some Miralax if you do have that afterwards, because otherwise you can get clogged up. So make sure that you're doing that. You do not want to get constipated. I definitely recommend that. Exercise and movement afterwards. Again, you're going to be painful, but you do want to get up and walk around as much as possible, as much as you can tolerate. So, don't overdo it, but get up, move around, do those things. It is going to help with the stiffness, the soreness, and the pain. Movement is good for you. So again, avoiding bending, lifting, twisting, but get up, walk around, and just move as much as you can tolerate. Studies have shown that will help with pain, and I really do think that that's helped me with my pain, is just getting up out of bed every so often, walk around the house, and do some, I'll do some heel raises and just move a little bit. If you are in bed, make sure you're doing your ankle pumps to avoid blood clots. You want to do those a minimum 10 reps every hour if you're laying in bed for a prolonged period of time to help avoid blood clots. Those are really the main tips after surgery. I will say, if you've been thinking about getting the surgery done for, sciatica or herniated disc, and you're having the numbness and the weakness down the leg, and you've tried everything else and it's been more than 6 weeks, you're going on months or maybe years, it has been a night and day difference for my pain. I haven't had the pain down the leg, thank God. I was laying everywhere that I could. It was absolutely miserable. but the pain seems to be gone. I have a little bit of numbness in the big toe, but that is about it. So I'm very hopeful that I'm going to make a full recovery. It is going to take time. Just realize it takes, time for that tissue to heal. It's going to take really 8 to 12 weeks before I'm back to doing most of the things that I love to do. So, and that involves what I like to do is like, exercise and weightlifting and golfing and just being active. So if you have any comments, please, or questions, please put them in the comments below. Happy to hear your thoughts. But those are my top tips for the first few days after spine surgery for the hemilaminectomy and microdiscectomy.